Nutrition science provide us with the tools to make healthier choices.
Billions of people in the world don't have enough to eat. The politics of food becomes very easy to understand.
What issues do you think, in your eyes, need more attention?
You could prevent these conditions by having people eat more healthfully. People eat highly varied diets, and their diets change from day to day. Food industry loves funding research. A healthy diet is so easy to explain. They're looking for high protein, high vitamin food. They're looking for plant food. Food is one of life's greatest pleasures, and you should enjoy everything you eat.
In each episode, we dwell into the realms of wellness, exploring the latest trends, expert advice, and practical tips to help lead you a happy, healthier life. We aim to bring a broader perspective to our American audience on issues that impact your daily life by interviewing guests from the US and around the world. From nutrition and fitness to mental well-being and beyond, we're here to empower you with knowledge and inspiration. So whether you're looking to boost your energy, revamp your diet, or simply trying to find a balance in your lifestyle, you're at the right place. Join us as we embark on a journey towards a better, brighter you. I'm your host, Dr. Amir Khan, and together let's unlock the secrets to living life to its fullest. How are food politics and nutrition science shaping our daily choices? From the labels we read to the policies that govern the public health. Today, we're diving deep into a topic that impacts everyone: what we eat and how it affects our health and the environment. Food choices are shaped not just by personal preferences, but also by complex systems involving government policies, corporate interests, and public health initiatives. With growing concerns about obesity, food insecurity, and sustainability, the importance of understanding politics of food has never been greater. Nutrition science provides us with the tools to make healthier choices, while food shapes the availability and affordability of those choices. Welcome to another episode of Khan Klinics, powered by the health section of American Muslim. Today, I'm your host, Dr. Khan. Our guest today, Dr. Marion Nestle. She is a professor of nutrition, food studies, and public health at New York University. In the department, she actually chaired from 1988 to 2003. She retired back in 2017. She earned her PhD in molecular biology and an MPH in public health nutrition from the University of California, Berkeley. She held numerous prestigious positions and was a senior nutrition policy advisor in the Department of Health and Human Sciences. She was also the editor, Surgeon General's report on nutrition and health. She's authored several books, and a recent book, Food Politics: How the Food Industry Influences Nutrition and Health, comes at a very timely occasion in the times when significant obesity exists, and we've had some groundbreaking medication impacting the obesity industry. Dr. Nestle, welcome to the show.
Oh, glad to be here.
Let's dive into the fascinating world where food and health and politics collide together. You're a professor of nutrition, food studies, and public health. Could you explain to our listeners how these three fields intersect, and why is it important that we look at them together?
Well, it's the question that I always get asked is, what does food have to do with politics? But food, nutrition, and public health are obviously linked. You have to eat to live. And the most important public health and nutrition problems in the world are not having enough food or eating so much of the wrong kinds of food that you gain weight and become obese and are at high risk for chronic disease. So, billions of people in the world don't have enough to eat. Even more billions of people in the world are eating so much of the wrong kinds of foods that they're overweight and at very high risk for chronic disease. Where politics enters that is that the food industry is a multi-trillion-dollar industry. Everybody eats, and there's an enormous amount of money in food
Mhm.
and in selling food. And the purpose of food companies is to sell food. And once you understand that, the politics of food becomes very easy to understand.
Thank you for explaining that. A lot of your research focuses on how the food industry shapes our food choices and our health in general. What do you see, Dr. Nassau, the pros and cons of the industry influencing average Americans' nutrition and health? What influences would you remove from the equation if you had a chance, and how?
Well, the first thing to understand is that food companies are not social service agencies and they're not public health agencies. They're businesses with stockholders to please. And under the current way in which the United States investment system works, the only goal of a food corporation is to make money. It's its only goal. And in order to do that, it has to sell as much of its products as possible to as many people as possible, as often as possible, regardless of the effect of those products on health. So, if I were going to make one change, I would regulate the ability of food companies to market junk foods to children. I think that's unethical and they shouldn't be doing it, and we should have regulations that stop it.
That's a very good point, and thank you for explaining that. Dr. Nesso, you've in your discussions about GMOs have also highlighted concerns beyond just their safety, such as environmental impacts and corporate control over food supplies. Can you explain a little bit about these issues to us and their implication for consumers in general?
Are you asking specifically about genetically modified
Yes,
foods?
ma'am.
Ah, so most in the and I mostly can speak for the United States. Almost all of the corn, soybeans, sugar beets, and some other products that are grown in the United States are genetically modified, and they're genetically modified to resist the effects of herbicides that kill weeds and kill non-target organisms. And the easiest way to explain what the problem
Mhm.
is to talk about corn production. If you look at the amount of corn that is produced in the United States every year, which is something along the lines of 12 billion bushels, we grow a lot of corn in the United States. Almost none of that is food. Almost half of it is feed for animals. All right, that's food in an indirect way. The other half is ethanol for automobiles. It has nothing to do with
Right.
food. That leaves something under 10% of the total corn production for all of the other uses of corn in the food supply. Almost none of it is for food. I think we need a food supply that grows food for people. And that's what we should be doing. We should have a food production system that emphasizes food for people and healthier food for people. Corn and soybeans, feed for animals, ingredients in highly processed foods. That's not the way health is promoted. If you want to promote the health of the population, you want to produce fruits, vegetables, grains, beans, nuts, at a price that everyone can easily afford. That's not what we currently have.
Thank you for explaining that. Thank you, Dr. Nasso. Dr. Nasso, let me go and ask you another question, and that's about food system. Tell us a little bit about what issues do you think, in your eyes, need more attention, to create a food system that works for everyone? And how would you address those issues? And then ask a follow up question regarding that, is that how do social and political issues influence a good system? I guess you could answer that in your question if you like to. Influences of social and political system, and then how do we create a food system that works for everyone?
Yeah, first of all, by food system, I think of food systems as referring to absolutely everything that happens to a food from the time it's produced, distributed, sold, bought, prepared, eaten, wasted, the whole thing. And it's very hard to explain why people eat the way they do unless you understand the way the food system works. In the United States, as I've already explained, the food system is designed to produce corn and soybeans. I mean, that's its main function. That's where all of the federal supports come in. It's what everything is designed to do. That's an industrial agriculture system that is not good for public health and it's not good for the environment. But the companies that produce those products and are involved in those products are extremely powerful politically. They fund election campaigns, they fund lobbyists, they do absolutely everything they can to make the political system keep things the way they are and not change them. So, if you want to think of a food system that's healthier, that system would be designed to produce food for people, not necessarily animals or automobiles. And that would change the politics enormously.
Thank you for answering that question. Dr. Nestle, let me come on something that is very current, and that is the impact of some of the medications that are driving obesity down, not up. I'm talking about specifically our audience wanting to know about Ozempic, and some medications along those lines. Tell us how do you see this impacting the food industry itself, the politics that revolves around it, and just in general, what's your take on this? There's been resistance, especially you can understand why there's been some resistance as well on having these medications come to the market. Want to know your thoughts on this?
Well, the main resistance is that you don't like the idea of people taking drugs for the rest of their lives when it seems so obvious that you could prevent these conditions by having people eat more healthfully. I think the drugs are fascinating. They're relatively new and their effects on people are quite astonishing. They make people not want to eat junk food. They make people want to eat more healthfully. They're not as hungry. They don't want to eat as often. They don't want to eat as much. They're losing weight. Their risk factors for chronic disease are dropping dramatically, and their risk factors for other conditions are dropping dramatically. So they seem to be kind of a miracle drug for people who can take them and not have side effects that are so bad that they have to stop, and for people who can afford them. And one of the big concerns about these drugs is their astronomical cost, not least because the companies that develop the drugs put hundreds of millions of dollars into convincing physicians and scientists and influencers in the United States and in Great Britain and other places in Europe that these drugs were safe and effective and everybody should be taking them and they should pay what the companies wanted people to pay. They're enormously expensive, and for people who don't have a lot of money, they're completely out of reach.
Thank you for answering that. And I see your point. I think it's about balance. At one end, we know that these are very impactful medications. It tremendously lowers down obesity. And then, like you've been doing your research for several years about how the industry and the food industry is going to be impacted by it. But at the other spectrum, we're talking about cost and how much of benefit are the pharmaceutical companies going to make from it? Let me jump on to the next question. And if you have any thoughts on follow up on this, let me know. We're going to talk about science behind nutrition and how it's supposed to guide us. And you've highlighted how the industry has been funding projects that are biased. And now that we have consumers who have some choices, they hear about this science, they're worried about this science, they're worried about a lot of things. How does a researcher or someone maintains integrity during these times? And what would you advise our listeners to, how should they navigate through the seas of this pool of information that is out there for them?
Well, the first thing to understand is that nutrition research is very difficult to do. And that's because people eat highly varied diets, and their diets change from day to day.
Mm-hmm.
They change from person to person.
Agreed.
It's very, very difficult to try to do large population
True.
studies and have them make any sense. The other problem is that if you ask people what they eat, they either lie or they can't remember or both. People like giving answers that investigators want, and in any case, you can't remember what you ate yesterday and
Right.
or how much. It's just I can't even begin to explain how difficult this research is.
Right.
So that's the first problem. And then because the research is so difficult, the results are usually, you get very small differences between one group and another. They require statistics to evaluate, and they require a great deal of interpretation. And interpretation depends on who's doing the interpreting.
Mm-hmm.
And then the other problem is that the food industry loves funding research because that influence, the influence of funding has been studied, and the research on industry funded research shows that it almost invariably comes out with results that favor the sponsor's interest. But the researchers didn't intend to do that. It, the bias occurs at an unconscious level. They don't realize it. They deny that there's a bias. And yet, if I see a study that looks at a single food and has a fantastic health outcome, my first question is going to be who paid for the study? And almost invariably, it will be the producer of that food. So for the public to try to interpret this kind of research is very difficult. You don't have access to the papers that disclose who did the funding. So I say if a study sounds incredible, it probably is. If it seems like it doesn't make any sense and it contradicts everything that you thought you knew, there's probably something wrong with it. I think you have to use a lot of common sense in nutrition, and a healthy diet is so easy to explain that the journalist Michael Pollan can do it in 7 words. Eat food, not too much, mostly plants. That takes care of it. You don't really need anything more than that. Anything beyond that is fluff. Eat reasonably and you're doing the best you can for your health.
So, on the topic of plant based diets, there's been a lot of interest from both the consumer side and for environmental reasons. What challenges and opportunities do you see in shifting dietary patterns more towards plant centric eating?
Well, I think you have to make plant foods accessible and affordable for people. A lot of people don't know how to cook. And if you want people eating them, you have to teach them how to cook. And the price issue is, I think, an enormously important one.
Right.
In the United States, the price of junk food has gone up much, much less than the price of fruits and vegetables. The price of all foods has increased, but the price of healthy foods has increased much, much more than the price of the ones that people ought to be eating less of.
Sure.
So that's a barrier
Sure.
for a great many people. And those are policy issues. If governments want people to eat healthfully, they have to do things that make it easier for people to eat healthfully.
Thank you for answering that question, Dr. Nestle. With the rise of this plant based food and this food being grown in the lab, lots of it, What do you see the future of the food evolving in the next decade? And factor that in with the fact that if obesity does go down, how would the role of foods such as plant based in a population that is now fitter, healthier, and however, maybe on some medication?
Well, people who are on those medications say they want to eat more healthfully. So they're looking for high protein, high vitamin, high, food. They're looking for plant foods. They're looking for foods that are going to be healthy. Um, and the food industry is trying very hard to figure out how to produce foods that are going to appeal to them. Cargill, for example, a major food producer in the United States, is now advertising some of its products as GLP-1 friendly. They're putting labels on the food that these are foods that are going to be particularly appropriate for people who are on these drugs.
Right.
But you asked about plant-based meat substitutes and cell-based
Right.
substitutes for meats. I mean, these are still in very early stages of development. It's been
Yeah.
very difficult for the producers of these foods to scale them up to a level where they're available at a price that people can afford. And I don't think we know the answer yet. I'm not interested in eating them. I think we have plenty of food available. I like eating real food. I'm not interested in artificial foods or meat substitutes. If I don't want to eat meat, I won't eat meat. If I want to eat meat, I'll eat meat. I don't see any need for that kind of substitute. But for the makers of those substitutes, they hope they'll find an audience.
So let's just draw our audience's attention on something that you're very enthusiastic about and you've talked about, and that's about comparisons. We're going to do a comparison between the big soda and the big tobaccos. How do you see them similar and how do you see them different, if there are any?
Well, food is not tobacco. Let's be very clear about that. We have to eat to live. So we have to have food. Where the similarities come in is in what is called the playbook. The tobacco industry playbook was the set of strategies that it used to try to convince legislators and the public that cigarettes were not responsible for lung cancer. So the first thing they did was to blame personal responsibility. It's not our fault if you smoke. We're not forcing you to smoke. If you smoke and get sick, it's your fault. Second was to cast doubt on the research. The research was, the studies were too small, they were too equivocal, the results were too complicated to interpret. You don't have to, you cast doubt on the research. And then you lobby, you talk to legislators, you do absolutely everything that you can. You fund your own research, you get scientists to talk about how good your products are. You do all of those things. And the food industry adopted that playbook completely in when it became clear that people eating a lot of junk food were not doing very well, and that the food industry's marketing of these kinds of foods, especially to children, was really something that was not good. And the food industry started fighting back because their job is to sell food.
Sure. Thank you for explaining that. I want to just touch on your latest book. I know you wrote several books: Safe Food, Why to Eat, Why Calories Count. But your latest book, I think, is on food politics, how the food industry
No, the
influences.
latest book is a memoir.
Oh, there's a memoir as well. Okay.
Now, Food Politics came out in 2002 and then in two subsequent editions in 2007 and 2013. The latest book is a memoir.
So, do you want to tell us a little bit about the memoirs, please?
Yes, it was my pandemic project.
Hmm.
I wrote it to answer the kinds of questions that I guess get asked all the time about why I do the kind of work that I do, how I happen to write it, how I feel about how I write it, about the kind of work that I do, and those kinds of very personal questions that I don't really like talking about. I'd much rather talk about the issues. But I ended up writing the book, and I think it turns out to be useful because it's one person's life, and those are always interesting.
Any last message would you like to give our listeners and the audience that are watching?
Yes,
Doctor?
absolutely. Food is one of life's greatest pleasures, and you should enjoy everything you eat.
Thank you very much for that, Dr. Nasso. Huge thank to you for sharing your valuable insight. And we really appreciate your research and obviously focusing a lot of people's attention on food, diet, and what is the politics evolve around it. I want to thank you for coming on our show, Dr. Nasso.
My pleasure.
Thanks to our amazing audience for tuning in for another episode of Khan Clinics. If you enjoyed the show, please share it with your friends. Give it a thumbs up, hit the subscribe button, and feel free to drop your comments. We love hearing from you. Don't forget to spread the word. Don't forget to tell your friends about us too. And a happy Merry Christmas. Thank you for everyone being with us. Thank you for the opportunity. And I want to thank my team who brought this presentation. This presentation was brought by Khan Clinics, powered by American Muslim Today. Please don't forget to subscribe, share, and comment in Khan Clinics. Thank you.